Hi and Assalamualaikum. My name is IZZUDDIN bin AZMI and my matrix number is 071136. So for today, my friend and I will discuss about one of view in skull and also in paranasal sinus. So this is us. So for me, I will explain about epiaxial skull, which is Town method. Now we will move to table of contents. So for the first one is we will explain about indication of each projection, and the second one is specimen radiograph. Alright, we will explain each projection by using specimen method. Alright, so as you can see, there are 4 indications for these projections. The number 1 is medial and lateral displacement. The second one is skull fractures. Number 3 is neoplastic changes, and the last one is Paget disease. Alright, so this is a normal radiograph of epiaxial skull, or known as Town method. So for this projection, there are few structure that we can see in the radiograph. So the first one from the top is parietal bone, and the second one is occipital bone, foramen magnum, petrous ridge, posterior clinoid process, and the last one is dorsum solae. Alright, now we move to the normal radiograph positioning. So for normal radiograph, the petrous ridge should be symmetric, indicating no rotation. The second one, dorsum solae and posterior clinoids visualized in the foramen magnum indicate correct CR angle and proper neck flexion or extension. The third one is underangulation of the CR will project the dorsum solae above the foramen magnum, and overangulation will project the anterior arch of cervical 1 into the foramen magnum rather than the dorsum solae. And the last one is shifting of the anterior or posterior clinoids within the foramen indicates tilt. Alright, now we will move to the positioning of abnormal radiograph. Alright, so as you can see, based on the picture, the petrous ridge not symmetric, patient's head tilts to the right, and patient's head not enough angle, which means the head of the patient not angled well. Then patient's parietal bone not well visualized. In epiaxial of skull or Town method, the parietal bone of patients must be visualized well and full. Then the petrous ridge and posterior clinoid not well visualized in foramen magnum. Now we will move to the alignment. Alright, so for tube and patient, it can be determined because there are no foci border of collimation. And for tube and image receptor, it also can be determined because of there is no foci border of collimation. So for the last one is image receptor and patient. So for this, as you can see on the radiograph, the foramen magnum is not at the center of the image. So we can say that this picture is not aligned at all. Now to the next slide, we will talk about collimation. Alright, for epiaxial skull or Town method, the good collimation of epiaxial must at the superior border must include parietal bone, inferior border must include dorsum solae, and lateral border we must include temporal bone. Alright, for this radiograph, it is not adequate collimation. Other than that, in this radiograph, there is no foci border of collimation. And as I said earlier, for this radiograph, the center ray is not aligned. So the center ray of epiaxial skull or Town method should be at the foramen magnum. Now we will move to exposure. So, for epiaxial skull or TAU method, the normal range of exposure is 70 to 80 kVp and 20 MAS. Alright, so for this radiograph, the kVp is good because the cortical outline at the thick and thin structure can be seen. For the MAS, it's adequate because the bony trabecular pattern at the thick and thin structure can be seen. So, for the marker, as you can see in the radiograph, there is no left or right marker indicate of the epiaxial TAU method area. So, for aesthetic, for epiaxial skull or TAU method, the film size normally used is 24 x 30 cm and the film orientation is lengthwise. Alright, so for the last one is name. As you can see in the radiograph that I provided, there is no name, no register number, patient's ID, there is no dates, no hospital, clinic or any institution's names. Alright, now we will go to the conclusion. Alright, so for the epiaxial skull or TAU method that I provided, which is abnormal radiograph, this radiograph is not acceptable at all. Because of what? Because of the radiograph don't have left or right marker, which make us and doctor don't know which side is the left or the right side. Other than that, in that radiograph also don't have the patient's name, patient's ID or hospital names. It make the radiograph not complete, which we will don't know whose radiograph is that. It can be others, it can be the other patient that come to the hospital. So that's all from me, and we will move to my friend Haiqal to explain more about his projection.
Hi and Assalamualaikum. My name is Muhammad Haiqal Muhammad ZULKIFLI. My metric number is 070344. So let's move to PNS lateral. First, we will talk about your indication for doing PNS lateral. So first is inflammatory, and second nasal bone fracture, and third fluid filled sinus, and 4 is foreign body. Okay, now let's move to PNS lateral basement. So first, their projection. So their projection must be include frontal sinus, ethmoid sinus, sphenoid sinus, and maxillary sinus. So this is a 4 main criteria that must be included in PNS lateral. Okay. In this basement, we will compare between normal radiograph and abnormal radiograph. So, at the right side is normal radiograph and left side is abnormal radiograph. So, normal radiograph, we will see a clear visibility of sphenoid sinuses. So, means that sphenoid sinuses at the EAM here, okay, is clearly seen, and superimpose of frontal, ethmoid, and maxillary sinus, celatosica, and orbital roof means there is no rotation. Means that no rotation means true lateral of their head. In MSP, their MSP is parallel to the IR. And lastly is superimpose of mandibular rami, means there is no tilting left or right of their head. So let's move to abnormal radiograph. We will see clear visibility of sphenoid sinus too. Superimpose frontal ethmoid, and maxillary sinus, celatosica, and orbital roof. And lastly, mandibular rami is not superimposed. We will see there is 2 lines at their mandibula, means that their head is little bit tilting to the right, so to correct this, move the patient head, tilt the patient head slightly until their MSP is parallel to the IR. So next, for the alignment, for the normal radiograph, we see X-ray tube, their alignment, X-ray tube and patient is aligned. So X-ray tube and image receptor cannot determine, and image receptor and patient is aligned. Okay, for abnormal radiograph, alignment of X-ray tube and patient is aligned. X-ray tube and image receptor, we can determine whether it's aligned or not. And lastly, image receptor and patient. By look at that picture, we can see that image receptor and patient is not aligned. Okay, next we'll move to collimation for abnormal and abnormal radiograph. So for me, both radiograph has same collimation. So for superior border, that include frontal sinus. For inferior border, include chin. For anterior border is skin margin, and posterior border at least external acoustic meters. So for their exposure, for normal exposure is 70 kVp and 20 MES. So the kVp, so for me, both of radiograph is their kVp is good for both because of bony cortical outline and at the thick and thin structures can be seen, and the MES is adequate for both radiograph because bony trabecular pattern of thick and thin structure can be seen too. So means like their exposure factor is adequate for both radiograph. Next we move to marker. So marker for normal and abnormal radiograph is same. So their marker is available, and their marker is in the right place, which indicate the true site on the radiograph. So it's not like the marker is not on the false side, and the marker is not superimposed with important error. Means like the marker is not in the region of interest. Okay, next we move to aesthetic. So for normal radiograph, we use film. We use is 18 times 34 cm with crosswise orientation, and for abnormal radiograph, we can see it use 18 times 24 cm. 18 times 24 cm film, and their orientation is diagonal. And lastly, for their name ID, so an abnormal radiograph, there's no patient ID, hospital or institution name. So that means the radiograph is not complete. So for me, the conclusion is the radiograph is not acceptable because of their positioning is not in true lateral, and there is no patient ID, hospital or institution name. So that's all from us, and thank you for watching.